It's been a very long trip for me. I spent 6 weeks in the Philippines. There were so many things happen when I was there. I bet some of you watched my YouTube videos about the tours that I did, the presentation that I did for DepEd, for healthcare department. I went to many provinces, many cities, and I had a really good time. So I'm back in Canada, back to Canada life. Napaka-swerte nyo na nandiyan kayo sa Philippines watching me right now. Sasabihin nyo siguro, napakaganda ang buhay ng Canada. Yes, ang ganda-ganda ng Canada. Pero dito, mga tao dito, they work 2 jobs, 3 jobs just to survive. Dito is just work. Sometimes walang life. Kaya napakaswerte nyo dyan that you'll be able to mingle with your friends, mag-karaoke kayo, mamamasyal kayo, may time off kayo. Mga tao dito, kalimitan, they have to work hard dahil sa mahal ng bilihin, sa mahal ng pagkain. So, wherever you are in the world, watching my YouTube channel, I hope that you've enjoyed the exploration that I did for my trip, for my seminar, for my school visiting, for my gift giving, lahat, etc. So today, I have the time to go through all the comments from my YouTube channel sa mga videos ko because I was so busy doing workshops, breastfeeding, DepEd, schools, teachers, presentations, kaya I didn't have all the time to go through the whole thing sa mga comments ninyo, or there were some of you, kudos to you, salamat for reaching out, messaging me privately, and asking me some advice on what to do with your baby, with yourself, with breastfeeding, with bottle feeding, etc. So today is a question, answer, comment day. There will be part 2 on this one, part 3, kasi isa-isahin ko talaga. I don't want to miss anything na tinatanong ninyo. Hindi ako ganong tao. Nakasanayan ko kasi as a healthcare provider, as an educator. I respect pag nagtatanong kayo, pag nag-i-inquire kayo, and I really appreciate that pag nagtatanong kayo. So today is question and answer day na pinipili ko talaga yung mga tanong ninyo para hindi ko ma-miss. If ever I miss some of your questions, please do your comment and I can go back and do it again and explain to you kung anong gagawin natin sa mga problema niyo with your baby, with yourself, with your bottle feeding, with your etc. So, the first question that I'm going to attack after coming back from the Philippines, you can see I'm still very tan. Ang sarap ng sunshine dyan sa Pilipinas, dito malamig na. So mamumutla na naman kami. So, first question na isasagutin ko. Itong nanay nito nag-reach out sa akin, kudos to you. Hindi ko lang mentionin yung pangalan, okay? This mom was breastfeeding for when she gave birth. But then, mga 1 month na ngayon na nag-stop siya breastfeeding, 1 month plus na, because she is taking anti-depressant medication or medication to make her feel good. So I did not ask kung anong klase, kung anong klaseng mental health issues, or kaya pag sinabing mental health issues, hindi sabihin na ang tao ay may mental illness, okay? Ito ang i-differentiate ko lang sa inyo kasi ito yung workshop ko na ginawa ko sa Bulan, Sorsogon, sa part of Visayas. So ito ang explain ko sa inyo kung anong difference ng mental health problems at mental illness. Okay? Ang mental health problems, normally, cause niyan ay mga social factors, environmental factors. Ibig sabihin, you're always tired at work or you're always tired at home, wala kang social support, wala si husband na nagsusupport sa'yo, you just gave birth, nagkakaroon ka ng depression, hindi ka makakatulog, nawala yung gana mo sa pagkain, nangangayayat ka, and then the doctor will give you some medication na pwede kang makapag-relax ang utak mo, makapagpahinga ka, and then you'll be able to to go to sleep. It doesn't mean na may mental illness ka. Ang mental illness is different. Mental illness normally genetics yun. Biological factors ang cause noon. Either, let's say, nanay mo noon, lola mo noon, may history ng depression, nakukuha mo yun. Dahil sa nasa dugo natin, nasa lahi, nasa history natin. So, ang tao pag sinasabing may mental illness, yun na yung severe depression. Yun na yung may schizophrenia. Yun na yung sinasabi nilang napapraning na, talagang nawala na sa pag-iisip. Yun ang tinatawag na mental illness. Ngayon, kung na-stress ka lang, lagi kang pagod, hindi ka makatulog, or kaya may mga taong nalululong minsan sa social media, laging nanonood ng TikTok or YouTube, or lagi na lang nasa computer, or lagi na lang anything with gadgets, nababawasan yung time nila sa pagtulog, laging pagod, matamlay lagi, wala sa concentration, hindi mo matawag kaagad na mental illness ang sakit ng tao na yun. Okay? So that's the biggest misinterpretation or misconception ng mental health problems as compared to mental illness. I hope na naliwanagan ngayon ng iba kasi minsan may mga iba kasi mga dahil nga sa discrimination dahil sa stigma ng ating society na pag sinabing na benat si ano o may depression si ano, may mental illness na yan, okay, napraning na yan. Yun ang sakit ng society natin. So kailangang maintindihan ng mga tao, kaya ako ginawa itong video na to. Para talaga maintindihan natin. Okay? So, mental health problems ay iba sa mental illness. Ang mental health problems ay marami tayong chances na nagagaling ka agad, ma-adjust ka agad yung lifestyle natin. Ang mental illness ay matagal, it takes a while for healing. You need prescriptive medication, you need some therapy para ma-recover ang mental health mo. It takes a while. Pero pag sinabing mental health issues lang, mental health problems lang, kakayanin yan either without medication, kailangan lang ng pahinga, kailangan lang ng counseling, kailangan lang ng support. Yun ang difference. Ngayon, itong ma'am na to, hindi ako nagtanong ng marami, sabi lang niya, nag-text siya ng medication, binigyan siya ng medication ng doktor niya na hindi siya pwedeng mag-breastfeed. Okay? So, dito sa Canada, pag ang doktor nag-prescribe ng mga anti-depressant medication sa isang manay na nag-breastfeed, there are times depende sa medication, okay? May ibang mga anti-depressant medication na hindi masyadong mataas yung factors yung component ng gamot that it pass to your breast milk na maapektuhan sa baby, okay? There are some antidepressant medication na minsan yung side effect noon either nakaka-affect sa mom or nakaka-affect din sa baby. Let's say for example, some antidepressant medication will cause headache, side effect yun. Sometimes have trouble sleeping, have trouble eating. So, naapektuhan talaga yung physical situation ng mother when it comes to taking any medication. Kahit anong medication na iinumin natin, kahit over-the-counter medication, may side effect. Okay? Pero mga minimal side effect, yung nabibili lang natin sa mga over-the-counter. Let's say, acetaminophen or ibuprofen. Yun na kayang-kaya. Kahit mga 1% lang yun pumapas doon sa breast milk. Pero doon sa mga matitinding, matatapang na mga antidepressant medication, minsan talaga sasabihin ng doktor, you stop breastfeeding. Okay? You're not allowed to breastfeed. Now, itong nanay na ito has been more than a month breastfeeding. Ngayon, nagtanong siya sa akin na after a month na nag-take siya nung gamot niya, pwede bang bumalik siya na mag-breastfeed? Yes, you can. As long as wala ka na sa medication noon, as long as yun din ang advice ng doktor mo. Ako po hindi doktor, I am a nurse, I am a lactation consultant. Wala po akong right na magsabi na, nanay, safe sa'yo ang mag-breastfeed kahit guminom ka ng gamot. No, hindi po ako pwedeng magsabi na ganyan dahil hindi ako doktor. Kung anong sabi ng doktor nyo, You have to follow what your doctor's advice, okay? Itong sa akin ay general information na sinishare ko sa inyo so that you'll have some ideas on how to prevent mga side effects na mangyayari sa baby. Let's say, for example, you're taking hypertensive medication ngayon para sa high blood mo, and then sasabihin ng doktor, you are not going to breastfeed dahil delikado sa baby mo. Bababa din ang blood pressure ng baby mo, magiging hypotensive yung baby mo. So, sundin nyo kung anong payo ng doktor nyo. Iba't iba ang opinion ng doktor. Ngayon, sa mga nanay, sa mga babae ngayon, you're pregnant or you're planning to have a baby and then you're taking medication, anti-depressant medication or any anti-psychotic medication. If you are breastfeeding, you need to continue pumping, stimulating this breast while you're taking that medication. Express the milk at throw it away. You have no choice. Kailangan you throw it away. Pag iyan ang sinabi ng doktor nyo, okay? Pag safe na, pag hindi na kayo laging pag hindi na kayo nagtitake ng medication na pinagbabawal ng doktor sa inyo, then you can always go back to breastfeeding dahil you never ignore this. If you ignore this one for 2 or 3 months, na nagtitake ka ng mga medication na pinagbabawal sa inyo ng doktor na mag-breastfeed at pinababayaan mo rin ito, this one will dry out. We don't want that to happen. So, sometimes, if you're taking medication now, pagdating ng 3 months, magaling ka na, at least, your breast milk is still there. Nakakatipid ka pa rin. So, that mom who asked me this question, salamat. At alam kong may mga iba ng nanay, some breastfeeding moms who are taking medication for anti-psychotic medication or antidepressant medication. You need to ensure that when you're taking this medication, that you have some guidance from your doctor, okay? Because there are some doctors, I'm just gonna mention this, okay? Some doctors would say, you can still breastfeed. However, when you breastfeed, you have to wait certain hours. Ibig sabihin, let's say, this is just for example, okay? Let's say you take your medication at 8 o'clock in the morning. You can breastfeed the baby maybe mga 7 o'clock in the morning before you take that medication. So you have 4-6 hours. If you want to do this, 4-6 hours for the second dose ng medication bago ka na naman mag-breastfeed. Some doctors would do that. Hindi ko alam kung anong ginagawa ng mga doktor niyo dyan. So again, it depends on the doctor. So there are some moms, I'll give you an example, some moms taking anti-hypertensive medication na sinabi ng doktor that you take medication, you breastfeed your baby first, then you take the medication after breastfeeding. So aabot yung mga 4-6 hours. Pag mga 4-6 hours, huwag ka muna mag-breastfeed doon. Hintayin mo munang mag-absorb ng system mo yung medication para hindi mag-pass lahat ng content ng component medication into your breast milk. Some doctors will do that. Hindi ko alam. It depends on some doctors, especially those doctors who have no knowledge about lactation consulting, okay? We as lactation consultant, we know what's the proper way, but we're not doctors. So again, thank you for the questions. Thank you for sharing that issues that you have. Feel free to message me again privately if you want to be unknown na hindi ko mabanggit yung pangalan mo. But thank you again. Alam kong maraming mga nanay who are taking antidepressant medication. Again, marami pa akong sasagutin. There's probably gonna part 2 of this, but I'm going to go through the whole list that I have para matutulungan ko kayo on what to do while you are breastfeeding or taking any medication. So again, if you're not taking at all any of the medication, you can go back to breastfeeding, but ask your doctor's advice. Bye for now. Next, I'm gonna answer more questions, okay?